Depression in children. Can children really suffer from depression? Yes. Childhood depression is different from the normal blues and everyday emotions that occur as a child develops. Just because a child seems sad doesn't necessarily mean he or she has significant depression. If the sadness becomes persistent, or interferes with normal social activities, interests, schoolwork, or family life, it may indicate that he or she has a depressive illness. Keep in mind that while depression is a serious illness, it is also a treatable one. How can I tell if my child is depressed? The symptoms of depression in children vary. It is often undiagnosed and untreated because they are passed off as normal emotional and psychological changes that occur during growth. Early medical studies focused on masked depression, where a child's depressed mood was evidenced by acting out or angry behavior. While this does occur, particularly in younger children, many children display sadness or low mood similar to adults who are depressed. The primary symptoms of depression revolve around sadness, a feeling of hopelessness, and mood changes. Signs and symptoms of depression in children include 1. Irritability or anger. 2. Continuous feelings of sadness and hopelessness. 3. Social withdrawal. 4. Increased sensitivity to rejection. 5. Changes in appetite, either increased or decreased. 6. Changes in sleep, sleeplessness or excessive sleep. 7. Vocal outbursts or crying. 8. Difficulty concentrating. 9. Fatigue and low energy. 10. Physical complaints, such as stomachaches, headaches, that don't respond to treatment. 11. Reduced ability to function during events and activities at home or with friends, in school, extracurricular activities, and in other hobbies or interests. 12. Feelings of worthlessness or guilt. 13. Impaired thinking or concentration. 14. Thoughts of death or suicide. Not all children have all of these symptoms. In fact, most will display different symptoms at different times and in different settings. Although some children may continue to function reasonably well in structured environments, most kids with significant depression will suffer a noticeable change in social activities, loss of interest in school and poor academic performance, or a change in appearance. Children may also begin using drugs or alcohol, especially if they are over age 12. Although relatively rare in youths under 12, young children do attempt suicide and may do so impulsively when they are upset or angry. Girls are more likely to attempt suicide, but boys are more likely to actually kill themselves when they make an attempt. Children with a family history of violence, alcohol abuse, or physical or sexual abuse are at greater risk for suicide, as are those with depressive symptoms. Which children get depressed? Up to 3% of children and 8% of adolescents in the U.S. suffer from depression. Depression is significantly more common in boys under age 10. But by age 16, girls have a greater incidence of depression. Bipolar disorder is more common in adolescents than in younger children. Bipolar disorder in children can, however, be more severe than in adolescents. It may also occur with, or be hidden by, attention deficit hyperactivity disorder, ADHD. Obsessive-compulsive disorder, OCD. Or conduct disorder, CD. What causes depression in children? As in adults, depression in children can be caused by any combination of factors that relate to 1. Physical health, life events, family history, environment, genetic vulnerability, and biochemical disturbance. Depression is not a passing mood, nor is it a condition that will go away without proper treatment. Can depression in children be prevented? Children with a family history of depression are at greater risk of experiencing depression themselves. Children who have parents that suffer from depression tend to develop their first episode of depression earlier than children whose parents do not. Children from chaotic or conflicted families, or children and teens who abuse substances like alcohol and drugs, are also at greater risk of depression. How is depression diagnosed in children? If the symptoms of depression in your child have lasted for at least 2 weeks, you should schedule a visit with his or her doctor to make sure there are no physical reasons for the symptoms and to make sure that your child receives proper treatment. A consultation with a mental health care professional who specializes in children is also recommended. Keep in mind that the pediatrician may ask to speak with your child alone. A mental health evaluation should include interviews with you, the parent or primary caregiver, and your child, and any additional psychological testing that is necessary. Information from teachers, friends, and classmates can be useful for showing that these symptoms are consistent during your child's various activities and are a marked change from previous behavior. There are no specific tests, medical or psychological, that can clearly show depression, but tools such as questionnaires, for both the child and parents, combined with personal information, can be very useful in helping diagnose depression in children. Sometimes those therapy sessions and questionnaires can uncover other concerns that contribute to the depression, such as ADHD, conduct disorder, and OCD. Some pediatricians start using mental health screens at a child's 11th year well visit and each year after. What are the treatment options? Treatment options for children with depression are similar to those for adults, including psychotherapy, counseling, and medication. The role that family and the child's environment play in the treatment process is different from that of adults. Your child's doctor may suggest psychotherapy first, and consider antidepressant medicine as an additional option if there is no significant improvement. The best studies to date indicate that a combination of psychotherapy and medication is most effective at treating depression. Studies show that the antidepressant Prozac is effective in treating depression in children and teens. The drug is officially recognized by the FDA for treatment of children ages 8 to 18 with depression. Other medications may be chosen if there are other coexisting illnesses contributing to the depression. Treating children with bipolar disorder. Children with bipolar disorder are usually treated with psychotherapy and a combination of medicines, usually an antidepressant and a mood stabilizer. Antidepressants need to be used with caution, as they can trigger bouts of manic or hyperactive behavior in children with bipolar disorder. Managing a child's medication must be part of an overall care plan that includes therapy and routine primary care appointments. The FDA warns that antidepressant medications may increase the risk of suicidal thinking and behavior in children and adolescents with depression and other psychiatric disorders. If you have questions or concerns, discuss them with your healthcare provider. Additionally, if your child is placed on these medications, it is still very important to continue to follow closely with the physician and therapist. Long-term outlook. Studies have found that first-time depression in children is occurring at younger ages than previously. As in adults, depression may occur again later in life. Depression often occurs at the same time as other physical illnesses. And because studies have shown that depression may precede more serious mental illness later in life, diagnosis, early treatment, and close monitoring are crucial. As a parent, it is sometimes easier to deny that your child has depression. You may put off seeking the help of a mental health care professional because of the social stigmas associated with mental illness. It is very important for you as the parent to understand depression and realize the importance of treatment so that your child may continue to grow physically and emotionally in a healthy way. It is also important to seek education about the future effects depression may have on your child throughout adolescence and adulthood. Depression in children, warning signs. Parents should be particularly vigilant for signs that may indicate that their child is at risk for suicide. Warning signs of suicidal behavior in children include many depressive symptoms, changes in eating, sleeping, activities. Social isolation, including isolation from the family. Talk of suicide, hopelessness, or helplessness. Increased acting out of undesirable behaviors, sexual/behavioral. Increased risk-taking behaviors. Frequent accidents. Substance abuse. Focus on morbid and negative themes. Talk about death and dying. Increased crying or reduced emotional expression. Giving away possessions. The link between depression and other mental illnesses. Clinical depression has been linked to other mental illnesses, such as anxiety disorders, panic disorder, social phobia, and generalized anxiety disorder. Together, these conditions affect millions of Americans. Fortunately, these disorders are treatable, and those affected can lead normal, productive lives. What is anxiety? Anxiety is a normal reaction to stress, but when it takes on a life of its own, it becomes an unhealthy, generalized reaction that affects the body and mind. Symptoms can include rapid heartbeat, aches and pains, and muscle tension. According to the National Institute of Mental Health, more than 18% of adults in the United States suffer from an anxiety disorder in any given year, and anxiety disorders are prevalent in 25% of children ages 13 to 18. Like depression, anxiety is thought to arise from a combination of both genetic and environmental factors. What is an anxiety disorder? Although anxiety is not always present in depressive disorders, most of the time it lurks beneath the surface. But true depression differs from an anxiety disorder in that a depressed mood is typically its most obvious symptom, whereas anxiety is the primary sign of an authentic anxiety disorder. Anxiety disorders include generalized anxiety disorder, GAD, panic disorder, specific phobias, social anxiety disorder. Previously, two other conditions, obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, had been classified by the American Psychiatric Association as being subtypes of anxiety disorders. However, in the most recent edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, each of these conditions is now classified as its own separate type of disorder. Anxiety disorders affect women twice as frequently as they do men. And many studies show that people with depression often experience symptoms of an anxiety disorder. An anxiety disorder that's left untreated can cause unnecessary suffering and impairment for both the person who has one and the person's family. Anxiety disorders include generalized anxiety disorder, GAD, panic disorder, specific phobias, social anxiety disorder. Previously, two other conditions, obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, had been classified by the American Psychiatric Association as being subtypes of anxiety disorders. However, in the most recent edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, each of these conditions is now classified as its own separate type of disorder. Anxiety disorders affect women twice as frequently as they do men. And many studies show that people with depression often experience symptoms of an anxiety disorder. An anxiety disorder that's left untreated can cause unnecessary suffering and impairment for both the person who has one and the person's family. What is generalized anxiety disorder? People with generalized anxiety disorder, GAD, are filled with greatly exaggerated worry and tension even though there is usually nothing beyond ordinary concerns to worry about. These individuals anticipate disaster and ruminate about their health, their finances, their work, their relationships, and family problems. To make a diagnosis of GAD, excessive worrying and anxiety have to occur more days than not for at least 6 months. The person is unable to control the worry and may have other symptoms including difficulty concentrating, fatigue, irritability, muscle tension, restlessness, sleep disturbance. This anxiety disorder is not related to substance abuse or a medical condition. It occurs independently. What is panic disorder? Panic disorder is another type of generalized anxiety disorder that often coexists with depression. Panic disorder affects 6 million Americans every year, most often young adults. Panic disorder involves the sudden onset of overwhelming fear and terror. The person may also experience chest pain, choking, difficulty breathing, dizziness, gastrointestinal distress, headache, shortness of breath, sweaty palms, tachycardia, an unusually rapid heartbeat, trembling. The person feels like he or she is either going to faint, have a heart attack and die, or go crazy. For somebody to be diagnosed with panic attack, at least 4 of the following symptoms need to be present. chest pain, choking sensation, dizziness, extreme sweating, fast heartbeat, fear of dying, feeling of losing control, feelings of unreality or being detached from oneself, hot flashes or chills, nausea, numbness, shakiness, shortness of breath. These symptoms are often accompanied by worry over the implications of the attack, like fear of death from a heart attack, and altered behavior, like avoiding a particular place because of the attack. What is phobic disorder? Specific phobias are the most common type of anxiety disorder. They involve an unreasonable or irrational fear of something that poses little or no real danger. The fear can be of a situation, object, or event. If people with phobias can't avoid what they fear, then it immediately results in a marked anxiety response. This response can include rapid heartbeat, nausea, or profuse sweating. Phobias are common and strike 1 out of 10 Americans, with women twice as likely to have a phobia as men. What is social anxiety disorder? Social anxiety disorder, also called social phobia, is a psychological condition that causes an overwhelming fear of situations that require interacting with another person or performing in front of others. Unlike being shy around strangers or nervous before a performance, social anxiety is a fear that you might humiliate yourself with your actions or speech in public. Social phobia is common. It affects more than 15 million people in any given year. It often begins in childhood and rarely develops after age 25. People with social phobia are often aware that their fears are irrational, but they are unable to ease or erase these fears. The symptoms of social phobia are much the same as symptoms for other anxiety disorders. They include difficulty talking, dry mouth, intense sweating, nausea, racing heart, trembling or shaking. Like with other anxiety illnesses, symptoms can be tolerable or so severe that they become socially debilitating. Does depression coexist with schizophrenia? Schizophrenia is a type of major psychotic illness that is usually marked by an inability to distinguish the real from the imaginary, confused or jumbled thoughts, and hallucinations. Feelings of emptiness and sadness may be a symptom of the disorder, but schizophrenia and depression are different on a neurobiological level. About half of people with schizophrenia may develop a major depressive episode at some point in their lives, but depression is not considered an enduring or hallmark feature of schizophrenia. If it seems to be a major symptom, you might want to consider schizoaffective disorder as another possibility. Is there a link between depression and eating disorders? Eating disorders frequently occur with depression and anxiety disorders. According to the National Institute of Mental Health, eating disorders are marked by extremes. They occur when someone severely reduces food intake or overeats to the extreme. Treatment may include antidepressants. The two most common types of eating disorders are anorexia nervosa and bulimia nervosa. Eating disorders are more common among teenage girls and women. These disorders often get worse the longer they go untreated. The lack of nutrition associated with eating disorders can harm the body's organs and, in severe cases, lead to death. People with anorexia purposefully starve themselves, despite their hunger. They tend to excel in sports, school, and work, often seeking perfection. Some people with anorexia stop eating in order to gain a feeling of control over their lives. Others may do so to rebel against parents and other loved ones. The diagnosis of anorexia nervosa requires that a person weigh at least 15% less than his or her ideal body weight. It is estimated that up to 3.7% of females will suffer from anorexia at some time during their lives. Anorexia is primarily a food restriction disorder. However, it is not uncommon for people with anorexia to purge, or empty themselves, through vomiting and abuse of laxatives, enemas, and diuretics. People with bulimia nervosa eat large amounts of food all at once and then vomit. The vomiting may occur multiple times during a day. The vomiting is triggered by a fear of weight gain or stomach discomfort. People with bulimia also use laxatives, diuretics, and vigorous exercise to purge themselves. In order for a person to be diagnosed with bulimia, this behavior must occur at least twice a week for 3 months in a row. Although people with bulimia are often underweight, they may also have a normal body weight. It is estimated that bulimia will affect up to 4.2% of females at some point in their lives. What about substance abuse and depression? Substance use disorders which are linked to depression involve the use of drugs or alcohol to the point of social, financial, legal, occupational, or physical harm. Millions of Americans abuse drugs or alcohol for a variety of reasons, among them to cope with stress and anxiety. Biological factors, such as a genetic tendency, may also play a role. Substance abuse may include some of the following symptoms. Continuing to use the substance despite the knowledge of its harmful effects on one's physical and mental condition. Finding it impossible to discontinue use despite making efforts. Giving up or reducing social, recreational, and work-related activities because of substance use. Increasing the amount of a substance used over time. Spending lots of time and effort either getting the substance or recovering from its use. Needing to increase the amounts of a substance in order to become intoxicated, or experiencing a diminished effect from continued use of the same amount. Taking more of the substance to ease withdrawal symptoms. Withdrawal symptoms such as nausea, shaking, insomnia, agitation, hallucination, and sweating following a reduction in the amount of a substance taken. There are varied approaches to treating people with substance abuse plus depression. Some will need detoxification in a hospital or a clinic. Rehabilitation may include one-on-one counseling, group counseling, and support groups. Antidepressant medicines in combination with education to help people address and conquer the emotions that cause them to abuse drugs or alcohol can also be effective.